I'm flipping through this CIO playbook. It really is step by step from forming a committee around opioid stewardship to creating a dashboard, has real world examples from health systems, how they did it. But that leads me to the question of the differences, which is I look at this playbook and I go, okay, you three are from fairly large health systems. Let's assume I'm a one hospital system. Am I following this playbook? Is there enough stuff in here and that I can do this without a significant budget?
Yeah, Bill, you've done many of these and across not just opioid issues, but lots of healthcare issues. The idea that we are unique in some way, or that Scott's team is doing something incredibly innovative in the halls of medicine, is probably far less than the 99.9% of what we do every day for the US healthcare system, which is to turn patients' health around in the same way. Well, actually, probably not in the same way. And that is part of the problem. And that is part of what I think as an informatics team, we can try to help normalize, which is that care ought to be delivered in the same way at a very high level across the United States. And the way to do that is through our EMR. And so much of that is our struggle on a day-to-day basis. Opioids are just part of that very small group where we would like to deliver the same messaging, the same way to wire the EMR out, the same delivery system, so that if Scott were to come down and get privileges and walk into one of the hospitals here in Charlotte, he would see the same look and feel and be able to take care of patients in exactly the same way as I would if I were to walk up and roll into the halls of Boston there. So it's a challenge that we struggle, whether we're talking about low risk chest pain or whether we're talking about the imaging for headaches or any of the other things that we've tried as a nation to tackle and do it in a better way at a lower cost in a more efficient manner that gives patients the comfort and safety to know they're being cared for. And so it's tough, but that is why we go to work every day.